Thanks very much for joining us here at the State Control Centre for some very important announcements in relation to COVID-19 and Victoria's response following the National Cabinet meeting held by Secure Video Link yesterday. The first thing I need to inform you and all Victorians of is that we are declaring a state of emergency in Victoria under the Public Health and Wellbeing Act. That state of emergency will be effective from 12 noon today and will run for 4 weeks. It is likely that that state of emergency will be extended and will be in place for as long as it needs to be. The other point to make is that that state of emergency, the provisions, the orders that are made as part of that will almost certainly change. We will try and minimise those changes so that we can have as much consistency, as much certainty for people who are impacted. But just as advice and response in bushfires changes, so too it will change in this COVID-19 emergency as well. We will be happy to take any and all of your questions in just a moment, but I just want to go through the main features of the state of emergency as declared today. You'll all be aware that the Prime Minister, with the full support of the National Cabinet following yesterday's meeting, has put in place mandatory quarantine for returned travellers. It is up to us as states and territories to give effect to that. So under the state of emergency that has been declared, it is an offence under the Public Health and Wellbeing Act to not comply with the orders that have been made. And those orders in the first instance relate to that mandatory, it's not optional in any way, mandatory home quarantine or at a hotel if you were not a resident. Now, that is a proportionate and appropriate response. We cannot be certain, given how much this virus has run in the US, in parts of Europe, in many other parts of the world. The status of those people returning is most uncertain, and in order to limit the spread of this virus, that is an appropriate response. Brett will speak a little bit more about these powers, all of them, and how they'll work in just a moment. The second part of yesterday's discussion, indeed this was a key feature of Friday's discussion at COAG in Sydney, was banning non-essential larger gatherings, gatherings of over 500 people, those that are not essential. Now, there are a whole range of gatherings that will be more than 500 that are in fact permitted. Things like public transport, where people are moving through, say, Fed Square on the way to somewhere else, workplaces, the list goes on, and Brett can speak to that in a moment. What we're talking about here is sporting events, cultural events, events that a club or an association might run, all of which are not essential. Big conventions, for instance, at the Melbourne Convention Centre or other similar venues. If they are over 500 people and they are not essential, and there are clear definitions about that, then they are not to go ahead. There are significant penalties for event organisers who fail to comply with that order. There are significant penalties across the board when it comes to these orders made under the Public Health and Wellbeing Act and under a state of emergency. I would just say, though, we don't anticipate having to be fining people. To this point, people have been cooperative, people have been, I think, acknowledging of the fact that we are all in this together, and following advice, doing the right thing is in your interest, your family, every family across our state. There will be significant disruption, there will be significant difficulty caused by these orders and many events having to be cancelled. However, I would say when it comes to sporting events, cultural events, conventions, those types of large meetings, we've already seen many of those events cancelled because people have exercised common sense and good judgment. For instance, this Saturday night I was to host one of the biggest and best events every year, the Premier's Multicultural Gala Dinner. There would normally be 1,500 people at that event on Saturday night. That has been cancelled. On Sunday, I would normally attend, along with others, Greek National Day at the Shrine. That has been cancelled as well. So many different, and we know of course AFL and other sporting codes have made appropriate changes. I think in the main, people are exercising common sense and good judgment. They're doing the right thing to protect public health. These orders take it one step further, and I will just foreshadow, as I think the Prime Minister went to this yesterday, Chief Health Officers across the nation are meeting today, tomorrow, throughout the week to provide further specific advice about specific settings like aged care and smaller gatherings. So we will have more to say about changes to these orders, potentially expanding these orders once that advice is finalised. There is a National Cabinet meeting on Tuesday evening, and we'll be able to make further announcements and give effect to those announcements from Wednesday. These powers have never been used before. That gives you, I hope, a really clear sense about the unprecedented nature of this public health emergency, this really significant challenge. Just finally, before I ask Brett to speak in more detail about the orders that have been made under the Public Health and Wellbeing Act, I just want to make a couple of broader general points. Firstly, these are not an absolute. These are not designed to have zero new cases. In effect, nothing we do can deliver that outcome. This is about, as everything we're doing, is about flattening the curve. If we can flatten that curve, then we can prevent our health system essentially being overrun by critically ill patients. Not just COVID-19 patients, but of course all those other patients every day of the year who need support for strokes and heart attacks, for very urgent surgery, so on and so forth. The second general point I want to make is that whilst it is perfectly appropriate for people, and it's advisable for people to, when they go and do their shopping, buy a few extra staples, the basics, it is not appropriate to go and buy 3 or 4 weeks or even months worth of shopping from A to Z on your normal shopping list. All that means is those who are more vulnerable, people who can't go to 4 different supermarkets to get what they need, will miss out. We have got care packages. We will get those to you in the event that you run out of those basics. Please exercise some good judgment, some common sense, and let's all be considerate of those in our community who are more vulnerable. Finally, we are in this together, and we're at our best when we work as one. The government has a plan. The government and all of its agencies are working hard, and with your help, we will get through this. Advice will change because that is the nature of a public health emergency. We will continue to be direct and frank and as clear as we can be, and always warn the community that whilst the advice and the settings are relevant and important for today, this is dynamic. It will change. We see that in our state, and we certainly see it in other parts of the world. I now might ask Brett to add to my comments on the specifics of what we have declared, the orders that have been made today, and then we're more than happy to take any questions you have.
Thank you, Premier. This is a significant step up in public health emergency powers. What it does mean is that there are powers that can apply through these directions to the entire state of Victoria and to an entire class of persons. And so we've seen that with respect to those who now require self-quarantine if they're coming to Australia for a 14-day period. We know it now applies to non-essential gatherings of 500 or more people, but it can apply more broadly and it can apply to much more specific circumstances. At the moment, as the Premier indicated, it's really for those non-essential gatherings in an enclosed space that bring people in close proximity. The things that are excluded: airports, public transportation, medical and health services, emergency services, aged care, prisons, correctional facilities, youth justice centres, parliament, food markets, or an office building, factory or site of construction that's necessary for its normal operation. So those are important exclusions, essentially because there are some essential elements that need to occur in those settings. But for all other settings, we're really talking about the cancellation or limiting numbers to below 500. Further directions will be given. We are meeting for 2 full days this afternoon and evening in Canberra and tomorrow with my counterparts, the Chief Health Officers and the Chief Medical Officer of Australia. And we will work through some of those other really specific details and some other questions like aged care. We will have further discussions around school and the evidence for or against school closures. But we really want to work through broader strategies for social distancing. And one of the key things to take out of this is that there's nothing magic about 500 people. For settings that have fewer than 500 people, no, there aren't cancellations that are imposed through this direction, but people should do the right thing. People should try and make a greater space between them. People should absolutely exclude themselves if they are unwell. They need to be at home, not at work, not in public places. And people need to do the right thing in terms of hand hygiene and cough etiquette. In terms of the daily update, we have had 14 new cases overnight, so it's gone from 57 to now 71 in Victoria. Those results came in quite late, so not everyone's been interviewed. My understanding is the majority are again overseas acquired. I think that'll change now over the following 2 weeks with the obvious quarantine arrangements and travel will drop off. We will potentially have an increase in locally acquired cases as time goes by. But the quarantine measures are really not to stop people developing illness who've come from overseas, but to make sure that when they develop illness, they will not infect others or expose others to coronavirus. Thank you.
Can I just, and again we'll take all your questions, I know you'll have lots, can we just make a couple of further general points? There will be some events where it can be a bit unclear as to whether they're covered by these orders or not. That's why the hotline, the well-publicised hotline, will also include a service for any event organiser who wants some advice on whether their event is covered by these orders. Common sense will be used. We don't anticipate having to penalise people, and a good deal of discretion will be used. As long as people make every effort to do the right thing, then they'll be protecting public health, and we'll be very grateful to them. We'll also, my office and others, will be reaching out to a whole range of peak bodies, the Australian Hotels Association, all the way through to the Convention Centre, lots of other groups where we will be having a discussion with them so that they're clear on what these orders mean. And then there's also a channel if they want further advice. It's impossible to draft an order that doesn't necessarily pose some questions, and the individual circumstances of every event will ultimately dictate whether they can go ahead or not. But the key points on the home quarantine, I think that's pretty straightforward. If you're a returning traveller, you need to be at home or in your hotel for 14 days. That's the only safe, smart and legal thing to do. When it comes to events over 500, is it over 500? Is it essential or not essential? If it's not essential, it should not go ahead, notwithstanding those exemptions that the Chief Health Officer has just read out. These things will change though. We will do our very best to make sure people are completely clear on what's expected of them. But as we've just heard, aged care, for instance, and other smaller venues, smaller settings I should say, are very much on the agenda for that very lengthy meeting that Chief Health Officers will begin later on today. Happy to take any questions you have.
What's the situation with in aviation with that 14-day quarantine? What's the situation with pilots and flight attendants?
So crew are not required to self-isolate for 14 days. The other group, just so people are completely clear, if you are a Pacific Islander, this applies in Australia and in New Zealand. Flying through Australia or New Zealand can be the only way that you can get home, so they're not required to self-isolate either. They're in transit essentially on their way home. So there are some limited exemptions to that 14-day self-quarantine, but it's critically important. We can't be certain about the virus status, particularly those coming back from many countries of the world, or indeed any country around the world that hasn't put in place some of the protocols that we've put in place. We're in a fortunate position, as challenging as this is. We have acted quickly. We are ahead of this at the moment. It will change. It will get worse. But this is a really appropriate response, and it was universally supported by all First Ministers. at the National Cabinet meeting yesterday.
Dr Sutton, in terms of the virus status, some GPs are uncertain about how far the virus has spread due to the rules around testing. Will they be strengthened or changed at all to allow more people to be tested or the right people to be tested?
Yeah, we have changed the testing rules right through this. The original focus was appropriately focused on those who were returning from international travel because that's where the vast majority of cases were. We focused right at the beginning on Wuhan and Hubei province, later to mainland China. So it's changed all the time. It will continue to change as community transmission becomes more likely and a greater proportion of all cases. We absolutely need to focus more on detecting community transmission. We do have other surveillance mechanisms to pick up the potential uptick in cases that are not related to travel. That includes surveillance through our hospital system for admissions and admissions to intensive care. So people with pneumonia are being tested in our acute care services. We also have a GP-based surveillance program where swabs are taken. We do that routinely for the flu season. That will now be a good foundation for testing for COVID potentially as well. So all of those mechanisms, including the data that we get from Nurse on Call for the calls that they receive and Ambulance Victoria data, will give us the kind of signals about whether community transmission is ticking up.
Premier Andrews, is Crown Casino exempt from the 500 grand?
No, the gaming floor, which is obviously a unique environment, there's only one of them in the state. The Chief Health Officer has been in contact with Crown over some period of time and they're putting in place some social distancing measures. I think a number of machines are being turned off so that there are bigger gaps between patrons. As far as the orders that have been made, a gathering over 500 other than on the gaming floor, so a concert, there are many of those at Crown, lunches, dinners, using some of the very big facilities, which are unique again in the state, they will not be able to proceed if there are more than 500 people. For instance, that multicultural gala that I spoke about earlier, that has been held at Crown in previous years. I don't think it was going to be at Crown this year, but those sorts of events, if they're over 500 at Crown or any other venue, will not be able to proceed.
Why do you think Hobart just do this on Friday?
Well, the most important thing to do is to make sure that when you're making a decision based on advice, that you can give practical effect to that. I think the extra time that we've taken, again, back to that central point, this is not an absolute thing. This is not a binary thing where by doing these things we're announcing today, we can guarantee there'll be 0 cases. That's not what we're doing. We are trying to flatten that curve. And I think in the interests of public confidence and getting this right, taking a little bit of extra time was the right thing to do. Just as Chief Health Officers, all of them, will take the time today and tomorrow to consider aged care in really careful detail, to consider smaller settings in really careful detail. And I'm confident their advice will change. They'll add to their advice and then we'll make appropriate announcements then.
You expressed concerns yesterday morning that there had not been more restrictions on people coming from the United States. Is this enough to...
Well, I did see some reporting of that, and I'm not critical of the reporting. I was asked a question and I answered it honestly. I couldn't explain the difference between some bans on some countries with very few new cases and other countries with lots of new cases not having travel restrictions. I'm very pleased. I know the aviation sector will find this incredibly challenging, but I'm satisfied and very pleased to see us move to the 14-day mandatory quarantine for all returning travellers. I think that is a proportionate and appropriate response and something that's supported by the very best of advice.
Premier, is there consensus within the War Cabinet?
Yes, absolutely.
Everyone's on the same,
Yes.
Is there much argument over, because, you've got 7 different states, so 7 different
Well,
views there.
what you've got is a group of national leaders who know that their fundamental responsibility is to follow the advice of experts and do everything we can to flatten that curve and prevent that catastrophic spike in demand and the collapse of our health system. Everyone is focused on that. Everyone's also focused on being as clear and as frank as we can with the Victorian and the Australian community, urging people to exercise common sense, good judgment, look out for each other. I know I've said it a lot, but it's true. We are all in this together and we will be much better able to respond to it if we exercise those courtesies and that common sense. you will hear me say this many, many times, but there's nothing more important. If you are sick, don't go to work. Don't go to public settings. Don't go to the movies. Don't act as normal. If you are sick, do not go to work. Use common sense. Hand hygiene, coughing etiquette, all of those things, they seem very simple, but they are so powerful in ultimately saving lives. That's the message. And the National Cabinet is absolutely unified to achieve that end, to flatten that curve, because that will save lives. It doesn't mean every jurisdiction's the same. There'll be different ways in which things play out in different states, but it is, I think, a positive step forward, and it will help us to have a much more nationally consistent response. Not uniform as such, because different states are different, but I think it is one part of what is a response to this virus that in many respects is leading the world.
Premier, a lot of countries have shut down their education.
Sorry, let's go to Tom first.
You mentioned before the care packages would be
Yes.
What do they include?
Let me take that on notice. There'll be a time for us to make those announcements. We've been doing a bit of this already, not as much as we'll ultimately finish up doing, but we have had a number of people who've had to self-quarantine, and for one reason or another they haven't had the sort of basics that they need, and DHHS staff and with EMV's support have been providing those care packages. We'll make some announcements about how many, what's in them in due course. But again, that's the central point. There's no need to go and hoard groceries and deny other people who are vulnerable the basics that they need. In the event, through no fault of your own, no matter the circumstances, if you found yourself at home without the basics, we will get those basics to you. We've already been doing it, and we do anticipate having to do a lot more of it. Brendan.
A lot of countries have shut down their education
Yes.
systems. Why doesn't Victoria follow, given that some schools have
Sure.
2,000 kids and
Yep.
teachers?
So let me make a couple of points, and then I'll ask Brett to speak specifically to how this virus is presenting in young people across the world, not just in Victoria, but right across the world, because I think that's a really important point. If you're going to follow advice, then you follow the advice. You don't. There's no picking and choosing. This is not a menu from which you choose the bits you like and ignore the bits you don't. The advice at the moment is that closing schools en masse, as opposed to closing schools where there is a positive case and where there's every reason to believe that there's been transmission, could do more harm than good. And I think in one of the papers today, there's some coverage where an example is cited of a mum of school-age kids who is a nurse. She would not be able to, like so many, have grandparents who are in that at-risk category look after their kids if schools were closed. She would be away from hospital, away from the critically important work that we need her to do, and so many like her. The key point here is we have advice, and the advice is not to close the schools. That can change. Some would say it's almost certain that it will. And when it does, I won't hesitate to act. On the issue of how, because I know a lot of parents are worried. My kids are at school today, talking to friends and family and lots of people over the last few weeks. People are concerned. I understand that. I absolutely understand that. But I think it's really important to highlight how this is presenting in children, because that I'm certain that will alleviate some of the fears that parents quite legitimately have. Brett.
Thanks, Premier. There really is genuine uncertainty in the evidence about the effect of school closures. We want to consider it in much more detail with my counterparts up in Canberra over the next couple of days. But to those points around what the potential risks are, yes, there's the risk of pulling people out of the healthcare system, other emergency services and other critical functions because they're having to care for kids at home. But there is also the uncertainty about what it really does to bring kids into a home setting where they have interactions with adults versus potentially mostly being engaged with other children who get very mild disease. For children under 9 years of age, it is extremely mild disease, and there are virtually no reports of deaths for those below 20. It's a tiny percentage. So it's important to recognise that. My kids are in primary school and in childcare, and I'm very happy for them to be there. If I hear evidence otherwise, I will apply to my own family and to all other families the best evidence to take the appropriate course of action. That applies to hoarding as well. I am not going crazy with my shopping. I'm buying a few more things as I go shopping routinely. And so, we all need to do what the evidence suggests is the appropriate course of action.
A question for
the
the
release mentions potentially locking down suburbs, having the power to do things like that. Can you explain how that would work? Is that if you've got, say, a cluster of cases in Richmond or something there?
Yeah, I think it would be an unusual circumstance in Victoria to be locking down a really tight geographic area. I think this is a virus that will have rather broad distribution. It might be very focused on metropolitan Melbourne because of the international travel focus here. But it would be very unusual to have a very tightly clustered setting. If that is the case, we could apply particular behavioural measures or particular movement restrictions in a defined geographic area if we think that's an appropriate and proportionate and precautionary response to a cluster.
In terms of Dr. Sutton, your advice yesterday regarding having the right amount of pharmaceuticals, is that still 60 days? Is that what you're advising? And there was some concern last night from pharmacists that they weren't consulted about this and not ready for that. What is your message to them?
Well, I think the great majority of people will probably fine with a month's worth. There are some individuals who may want more than that, and up to 60 days is okay. I think it's important that people who are vulnerable, especially the elderly who are more likely to have prescription medicine, might want to be staying away from pharmacies for a period of time where, let's face it, people with symptoms and who might be unwell might be attending. So I think 60 days is possible, but for the vast majority of people, 30 days will be sufficient.
Can I ask Commissioner Chris a question?
Certainly.
In terms of the emergency services, what effect will this have? Obviously, they have to enforce the order, but they're out there in the community, day to day with people dealing with this thing and are at risk of catching the virus themselves.
That's exactly right. We know there are some people that just can't work from home, and the reality is that's our frontline responders. So whether that be our ambulance officers, our police, and a whole range of other services. So they have developed their own business continuity plans and specific COVID-19 plans, and they are looking at what they can do to prioritise their service delivery based on a number of people actually not being able to work. Whether that's in fact because they've got to take on care or responsibilities, or they might become sick themselves. And we're meeting every second day now across the emergency services to make sure that we are coordinating our efforts and our energy around that.
Do you know if there's any update on Victoria Police's policy of taking, or maybe the Premier might be able to answer this, of taking swabs and drug and alcohol tests?
No, I can't update you on that. Well, I'm going to get Victoria Police to come back to you.
The people in quarantine, can I just check, maybe Doctor, the wording here is you can leave your premises where you're being quarantined, either a hotel or a home, in circumstances where it's possible to avoid close contact with that person. So can you please define close contact? Can I wander down to the supermarket, buy some supplies and go back home?
No, not if you're going to be in essentially face-to-face contact with other people. If you're going to be in a queue, if you're going to be in a line, that's too close. But we don't want to stop people being able to go out in their own garden, to be able to walk the dog, to go to the park, where they'll have a sufficient space from other people.
They'll have to order in food, basically.
Yeah, we're hoping that people can have the right supports from family and friends to give them food or order online. But as we've said, there is the helpline available for those who are stuck and can't do that.
Parliament? I mean, it's still going ahead.
Parliament will proceed. There may be some changes to the way Parliament operates in terms of length of sitting and some other social distancing measures. There's some discussions going on between Jacinta as Leader of the House and other parties, and we're hopeful, and the presiding officers. And we would hope that approach would be across the whole Parliament.
Is there legislation you have to pass tomorrow?
No, the powers that we have invoked today and we are using and will continue to use are all powers that currently exist within the Public Health and Wellbeing Act.
How will these orders be enforced? And do you expect members of the public to let authorities know?
I would hope that. Well, I think, again, common sense, and I think the Prime Minister used an example yesterday of someone who's known to have returned from a trip who turns up at work. I think that they would find themselves in some difficulty. No doubt a member of the public would perhaps raise concerns with them, with the employer and potentially with authorities. In terms of enforcement, we're having some discussions with the Victoria Police, and I'm confident that we will have spot checks for people who are returned travellers. So you'd be very unwise to return from overseas, be subject to this quarantine and not do the right thing, not only are you putting the health of your loved ones, every family across Victoria at risk, but you're also breaking the law. There are substantial penalties, up to $20,000, and I think police will be a part of making sure that people do the right thing. I think common sense and that sense that we're all in this together will drive people to do the right thing. That's certainly been our experience to this point.
So if you get people coming into Melbourne to travel, say, regionally, are you expecting them to be self-quarantined in a hotel recovered for a while, or will they be out of transit?
I'll let Brett speak to that.
If people can find accommodation that allows them to see out their quarantine for 14 days or for whatever time that they're here, that's fine. But for those in transit, they can continue in transit.
Greg, what is your advice to the AFL?
Sorry?
What is your advice to the AFL at this stage?
I've spoken to Gil McLachlan. He's to his credit, absolutely supportive of the approaches taken. I know it's enormously challenging for the AFL. I think it's part of the social fabric in Australia. I think it's an absolutely important thing for us to see as part of our lives. What is operationally feasible for the AFL is up to them. I've said, obviously, that they have to be patron-free. But whether it's a closed-door event is really up to the AFL if they think that that's something that can be organised.
Do you find with, obviously there's the mass gathering 500 band, but you'll find with 36 players, umpires, people being on the field?
Absolutely, absolutely. Thank you.
Thank you all very much.